If you're trying to conceive and feeling overwhelmed with fertility advice, then this podcast is for you. Welcome to Don't Tell Me to Relax, your fertility podcast and antidote to unhelpful fertility information. I'm Hannah, a fertility acupuncturist, teacher and campaigner for better fertility education. This podcast aims to empower and inform you about your menstrual cycle and fertility. It's basically all that information you didn't get in sex ed at school, with the aim of improving your understanding of your reproductive health and optimizing your fertility. Before we start this week's episode, this is a quick plug for our fertility support events coming up in our community in June and July. We have a webinar on unexplained infertility, yin yoga, a Q&A with our fertility nurse, and a drop-in tea and chat support group. To join, please just follow the link at the end of the show, and please do share with anyone who might also find this helpful. Today, I am joined by Hazel Leonard, who is the founder of the Prepared Pineapple, which is quite difficult for me to say, but is an excellent name. Hazel is a fertility educator, registered midwife and IVF mum. So Hazel, there is no better introduction than you to introduce yourself and tell us how you came to work in this space and what you do.
Thank you, Hannah. Thank you for having me on. I feel very privileged to be on your amazing podcast, so thank you for that. So as you said, my name is Hazel. I am a midwife. So I first qualified as a midwife in 2008 in the UK, worked in the UK for a few years and then relocated to Dubai in the UAE. Kind of went on my own fertility journey first. So in 2014 I got married, and then a few months later we started trying and nothing happened. And then that went on to like a 5-year kind of infertility journey. And what I realised going through that was that there was very little in the way of support, very little in the way of education. You know, I'm a big advocate for women and for female education and for empowerment and being able to make informed decisions. And I just didn't feel that was there. I felt it was very doctor-led and very, you turn up at the clinic and you're going to do this, you're going to do this, you're going to do this. And that's just not what I was used to as a midwife, and giving that empowerment to people. So I did some additional training, fertility awareness, fertility education, so that I could support people through this journey as well as through pregnancy and birth. And that's where I am today.
And did you go through your fertility journey were you in Dubai when you went through your journey?
Yes, but I have had fertility treatment in the UK as well.
Yeah.
So I've had varied experiences of care.
Does it differ wildly between the UK and Dubai?
Well, when I had my treatment in the UK, I will say that I was a private patient. So
Yeah.
I do think that makes a difference. Everything in the UAE is private healthcare, so it is run a bit differently. There's pros and cons. I love the NHS. I trained in the NHS. I think it's fantastic. But as you know, and especially when it comes to fertility, it has its limitations.
Yeah.
The good thing about private is that you can have an appointment when you want. There's no wait times. You have more flexibility, but then equally, you can feel like, do you really need all these tests, all these investigations, all this treatment, or are you just after my money? So that's you know, whereas the NHS is very standardized and everybody gets offered this. Well, the postcode lottery dictates that not everybody gets offered the same thing. But when it comes to receiving the treatment, there's a little bit more structure, I find, and a little bit more continuity across the board.
Yeah. So today we are going to be talking about pregnancy after fertility struggles and loss, which is something that I think is a really important topic. And it's very well timed because last night I was in clinic and I treated a lovely lady that I've been working with for about 6 or 7 months who has just got pregnant, and she's got pregnant after 2 years of trying and a miscarriage. And you know, as she walked into the door last night, she said to me, she said, Hannah, I never thought that I would get to this place. And now I've got to this place. It feels even worse. So, she was really, it was like the wheels had come off.
Yeah.
She was very anxious, really feeling very stressed and overwhelmed with the whole situation. And I thought, wow, this is a really important topic that I feel, is good to talk about. So tell me, because you must have been through it from a personal perspective and you must have supported
Yeah.
people yourself through your work. Why is it different? Let's just explore a little bit about why it's different when you get pregnant after you've been through fertility problems or you've been through miscarriage.
It's interesting because when you said that about her, I got goosebumps because I
Mm,
know that feeling of, I think the biggest thing is that you've set this goalpost of pregnancy. So it's very triggering. And anybody that might even look at the title of this, like, oh, well, I'm not there yet. I don't need to, when I get there, it will be fine. That's what you set. You set yourself the pillar. The pillar is up here and you go pregnancy, pregnancy. When I get to pregnancy, everything will be okay.
mm,
What you don't realize is that when you get pregnant, it then opens up a whole can of worms. And because you don't believe that it's real. And I've supported so many women. And when you start talking about fertility treatment and pregnancy, they will then start opening up to you. And the anxiety and the fear, and then you reset the goalpost. The goalpost is always moving. And it rarely do you focus on having a live baby at the end.
mm.
The focus, I can imagine when you spoke to her last night, her focus, if she's had a loss before, especially, I'm not sure when she had that loss, but if she had that loss, let's say 7 weeks, her initial goal will be, I need to get to 7 weeks. And then when she gets to that goal, it will be, I need to now get to the next scan. And then when you get to the next scan, okay, well, I haven't felt any movements yet, so I need to get to this gestation so I can feel movements. And then when you feel movements, like it's a rolling ball and it just keeps going.
Yeah, and it's so I always find it amazing when I work with people and they go in for their, like, for example, their booking in appointment with their midwife, and if they've been through IVF, then it's literally a tick box.
Mm-hmm.
And it's very much like and it might not be for all cases, but this is what people tell me in clinic, is that they get to their booking in appointment and there's kind of like all the questions that you have to go through, but there's no sort of time and space to acknowledge or discuss the journey to that point and that booking
Yeah.
in appointment. It's like everybody who's sitting in that booking in appointment is exactly the same. There's no kind of
Yes.
acknowledgement of the history of that
Agree.
person. And I just think that must be really difficult because it's not the
Yeah.
same, is it? It's not the same as you have sex, you get pregnant straight
Yeah.
away, and you go to your booking an appointment and you feel all this kind of excitement and hope and joy with no
Yeah.
understanding, appreciation, or experience of the sort of vulnerabilities and the things that can go wrong in a pregnancy, which for those people, fantastic, great, amazing. What a lovely place to be. But for lots of people, that's not the reality. And I feel like when you don't get an acknowledgement of it, it kind of exacerbates those feelings.
Absolutely. You're 100% right. Like you say, you turn up to the booking appointment. And in the UK, it's normally a 45-minute appointment and it goes into everything. We want to know everything about you. But there isn't that space to acknowledge and to validate somebody's feelings of,
Mm.
actually, I'm terrified. I'm terrified that this is going to go wrong. And you don't feel the same. And people have said to me, I want to scream. No, I don't think you understand. This pregnancy is different. This is not the same as the last lady that came in, because you always presume that everybody else in the world was pregnant or pregnant naturally.
Yeah.
And no one else is pregnant, struggled. And you want that to be acknowledged, and you want somebody to, validate that this is hard and you are terrified.
Yes, absolutely. And so what are the common concerns that you have encountered from that people sort of say when they are in this situation? What are the concerns that come up?
So anxiety, I think, is a big one. The anxiety that things are going to go wrong. And that's completely normal as well. Another big thing that I come across is people not wanting to talk about how hard they're finding it. So you get this almost this glorification of pregnancy of, oh my God, I'm pregnant. Don't complain. You could be, I've met women that have had horrendous pregnancies. They've had hyperemesis, which, if you don't know, hyperemesis is severe vomiting in early pregnancy, often results in hospital admissions. I say early pregnancy, sometimes it can continue for the whole pregnancy. Dehydration is debilitating. And mothers, they still won't complain. Women will still go, yeah, but I wanted this. So because I wanted this, I have to endure what comes with it. And I cannot complain because it gets me a baby at the end. So this is what I have to go through. Whereas people, if somebody conceives spontaneously and there's no complications, they've got no issues with complaining. How often have you heard people moaning about their pregnancies or moaning about their babies or their children? And it's okay. It's okay to say you find pregnancy hard. It's okay to not enjoy every single moment of being pregnant. Some people hate it. I mean, equally, some people love it. But if it's hard, you can say it's hard, and that's one of the biggest things that I think people worry about, is being honest.
Yeah, and that is such an important thing, isn't it? That people often, I don't know whether there's ever been studies, and I wonder whether in terms of the links between fertility struggles, miscarriage, and then postpartum problems. Yeah. I imagine that there is a link. It's
there
just,
is.
yeah. So have they done studies?
There is research to show that if you have experience infertility or fertility struggles, you are at a higher risk of postnatal depression.
And do you think that comes from that kind of, that sort of sense of holding back in terms of, admitting that you might not be enjoying it, the kind of guilt, all those kind of really big feelings that must come? Yeah.
And I think also people don't the goal is pregnancy, right? So when you get into pregnancy, the goal then is sustaining that pregnancy. But then what happens is a little person arrives that you have to look after, and they will completely rock your world. And, for me, I experienced a similar thing. And my little boy was not an easy baby, and I've been a midwife for 10 years when he was born. So I was like, I can do this. This is fine. He cried. He never slept. It was during COVID, so no family was allowed to visit. We weren't allowed to see anyone. And I was alone with this grumpy baby. But I didn't feel that I could tell anyone that I was finding it really hard, because I felt like professionally, personally, this is what I've been working for. I'm not allowed to find it hard. And sometimes I just, cry. He'd be crying and I'd sit there crying and not talking about it, because you don't feel like you're allowed to, even though I know now, and if it was one of my clients, I'd be like, call me, tell me, I'm here. I want to support you.
Yeah.
But you kind of put motherhood on a pedestal, and you have this image of, when I get my baby in my arms and I'm sitting there and I'm feeding this little person, everything will be okay. And it doesn't always live up to our expectations of this thing that we've idolized and kind of put up here for such a long time. It's really tough.
Yeah. And I guess the thing is that the trauma of whatever your journey has been, whether it's miscarriage, whether it's rounds of IVF, years of trying and it not happening, getting pregnant and having a child does not cancel out that trauma.
No.
It doesn't absolve it. It doesn't kind of, it's obviously what you wanted, and it's amazing. But the trauma is still the trauma, isn't it? And it's not like trauma gets cancelled out by a thing. It gets cancelled out with time and process and support and all of those things. And also
those triggers. Sorry.
No, I was just going to say trauma often stays with us, doesn't it? It's, we might be able to move on in life, but that trauma is often still there.
And it's one of those things that a colleague was recently saying, she works in this space as well, but she still finds pregnant bumps triggering.
Yeah.
She has twins. She has no intentions of having any more children. But the triggers that were there when she was trying to conceive and going through fertility treatment are still there, and she has to, she'll see a pregnant bump and she'll go, ugh, God," and then remind herself, actually, no, it's fine.
Yeah.
I'm not there anymore, but that trauma kind of stays with you. And I know pregnancy announcements for a lot of people in this community are really hard. And even when you get pregnant, those things will still be triggering, may still be triggering for you. And that's okay. And I think it's okay as well to create that safe space around yourself. I've supported people that have experienced infertility, have experienced loss, and have actually hid their pregnancies for until they're 5 or 6 months, until they can't physically hide their bump anymore before telling people, because they're so worried that things are going to go wrong, that trauma is still with them. And they're kind of terrified of opening up and telling the world. And you have this with infertility struggles anyway, don't you? You have this kind of stigma of not talking to people about it, not telling people what you've gone through, and then to become pregnant only to believe that either you don't deserve this or it's not going to continue because you've worked so hard for it, so why would you have a live baby at the end of it? You then continue to hide and you continue to cover up what's happening to you and how you're feeling about it.
Yeah, it's such a complicated place to be, isn't it? It's so difficult and so I guess unique in a way of life experiences to be in that place. And I often work with people who are, that whole kind of, if I talk about it, I'm jinxing it, or if I acknowledge it, it's kind of all going to go wrong, or if I feel happy about it, the pain is going to feel even worse.
Yes.
It's so complicated and so difficult to unpick. It's really, really difficult. But in terms of like, what can people do in that situation? What would you say of like things that people can do to sort of feel a bit more in control and a bit more empowered?
Well, I think one of the first things is opening up about it, is talking to people about it, and it can be a professional, it can be a friend, it can be somebody that you know has gone through it. It could be reaching out to this kind of community. Now there is a space in between it, and it sometimes feels like you're not part of the infertility community anymore, but you're also not part of the spontaneous conception normal pregnancy community. So I'm creating a space for that shortly as well on my to-do list. But just a space with other people that are pregnant, that are know what it feels like. So talking about it is the first thing, whether professionally or with friends. Do you need to have some form of like an alternative therapy? So things like acupuncture can be really helpful in helping you to relax. I saw an osteopath during my pregnancies, and they were great in helping with that physical and mental kind of burden to really say offload that a little bit. Opening up with your midwife. I love the midwifery system in the UK, because I feel like I might be slightly biased, but I feel like the midwives are can be really very supportive, or seeing what's available in your community can be really helpful. And counselling therapy, if you need it.
Yeah.
Go and see a counsellor or a therapist, because your friends can sometimes understand, but then sometimes they're like, well, you're pregnant now, I don't know what you're worried about. But if you're speaking to a professional, then they're completely detached. They don't know your friends, they don't know your family, so you can kind of offload how you're feeling about that. Don't Google every single symptom. That's something else as well, which we do throughout the fertility struggles journey. You will always find a story of somebody that experienced the one thing that you want to know about. If you don't feel terrible, that's okay. If you don't feel like nauseous all the time, or you don't have any symptoms of pregnancy, it doesn't mean things are going to go wrong. If you do feel nauseous all the time, or you are feeling awful, it doesn't mean that things are going to go wrong. You're constantly looking for that physical validation that is this normal? Is this twinge okay? Is that twinge okay? I haven't felt anything yet. That means I'm obviously not pregnant. I don't have enough hormones. So not reading into the physical side of pregnancy too much.
Yeah, but it's so difficult, isn't it? Because we have obviously, we work mostly with people trying to conceive, but when people do conceive, we always say to people, please stay with us to 12 weeks because, acupuncture is completely safe in early pregnancy. And, all the research shows that, it doesn't matter whether you go for acupuncture, reflexology, counseling, going to somebody and getting that support, that one-on-one support is really, really beneficial. And so people sometimes can come in and they might have sickness. And so we, with acupuncture, we can work on sickness, and then the sickness goes. And then they ring up and they're like, oh my God, my sickness is gone. And we're like, well, that's what you came in for. That's why it's gone. And then it makes them feel even more anxious because sometimes people were quite not liking, but, they were finding reassurance in the sickness symptom.
Yeah. And there's this really awful time, I say awful, but it's really uncertain time that on lots of fertility journeys, especially if you conceive through IVF or ICSI, you generally have more scans earlier on, which is quite reassuring because, you can see that your baby is growing. And then you kind of get to 12 weeks, and then in the NHS, you might then be passed over to your midwife, depending on the clinic and depending on the age. Here in the UAE, you'll see a doctor, but at about kind of 7-8 weeks, and then they'll do an ultrasound, and then they'll do an ultrasound at 12 weeks. But then between 12 and probably, I'd say, about 18 to 19 weeks, generally you start feeling movements. Anything between kind of 17 to 20 weeks, depending on where the placenta is, depending on baby's position. And you've got this like month to 6 weeks where you don't feel nauseous and you don't feel movements, and there's it's all gone. And lots of people convince themselves in that window something's wrong because you don't have regular scans then until you're 20 weeks. You can pay for a scan, but you're not going to pay for a weekly scan from 12 weeks. Doesn't make any sense. So there's no confirmation that there is a pregnancy, whereas from when you start feeling movements, every day you should start feeling movements and they get stronger, and that's the validation that there is a baby.
Yes.
Whereas, in that time there isn't.
What do you think about going for scans in the early stages? Because lots of people, obviously, if they're going through IVF, you get an early scan at 7 weeks. If you conceive naturally, you don't. Like in the UK, you have to wait till 12 weeks. But I know lots of people who go for scans every 2 weeks, every 10. It can become quite a thing. I feel like people go either into two camps. They either go into I'm going to go for a scan on a regular basis, or they're like, I'm not going to go for a scan until 12 weeks because I don't want to engage in scanning because scanning is quite triggering in itself. I guess, I've answered the question. There's no right or wrong. It's whatever works for you.
Yes, no, very, very valid point. And there is the question mark of, will too much scanning be dangerous for my baby? People worry about that. And that's a very difficult thing to measure because there's so many external factors. As far as we know, frequent ultrasounds are not dangerous. But it's not an easy thing to measure. But I would say, for your mental health, if you are really struggling, you're freaking out, you feel like you're on the verge of having a panic attack because you just don't know what's happening, it's worth having that ultrasound. If you can afford to pay privately for an ultrasound, and it makes you feel better, then it's worth doing. But then equally, if you're like, no, I don't want to, then there's not a medical reason to. If you were to have quite heavy bleeding, if you were to have something that was similar to a normal period, even in the UK, I know very often with early miscarriage, that can be quite hard as well if somebody is having an early miscarriage, because the watch and wait approach is quite common. In the UAE, it's a bit different. They will scan you and intervene, but I do know people that've gone to A&E in early pregnancy with heavy bleeding, have just been sent home and told to wait and see. And that watching and waiting is really hard because you're in limbo and you spend so much of your fertility journey in limbo of waiting. Is this going to be the one? Is this it? So if you're worried, you've been told to watch and wait and you just want to know, then it's also worth having an ultrasound to see.
Yeah.
But otherwise, if everything's okay, if you're feeling a bit nauseous and that continues and you've got there's no overriding concern, then you wouldn't necessarily need a weekly or bi-weekly scans.
Yeah. The other thing that I often talk about with patients is this idea of if you are taking progesterone,
Yes.
so, again, whether it's an IVF pregnancy or a natural pregnancy, I have this feeling, and I might be wrong, but I feel like when you're on high levels of progesterone, it can really amplify your emotions. So those feelings of anxiety, insomnia, the feeling of out of control, the overwhelmingness, I feel like progesterone doesn't really help in that situation. I'm not saying it's all because of progesterone in any way, shape, or form, but I feel like it just ramps it up even more than it makes it more acute than it would be in other situations. What do you think about that?
I mean, I agree in the sense of don't underestimate your hormones. I think we always, I think as women, we are we are expected to just get on with it. You've got PMT, get on with it. There's a lot more coming out about menopause as well, which is quite interesting. But the impact that has on women and their mental health, we can't underestimate the impact that early pregnancy hormones, progesterone, like is quite high. It's a heat hormone, so it can make you feel hot. It can make you feel restless. If you suffer throughout the second half of your cycle, you have a high levels of progesterone. So if you're adding to that, and you previously suffered in the second half of your cycle and you're giving yourself more progesterone, you're probably going to be quite sensitive to it. So you're going to feel anxious and heightened and uncomfortable. And like you say, the insomnia, the sweats, the nausea, putting all of that into play, your hormones are all over the place. So when you add that to an already challenging situation, physically and mentally, it does take its toll.
Yeah. I always say to people, it's like, it's one of the hardest things that you can go through because you have no control. You have to go through it. There's no shortcut. There's no way around it. You just have to kind of, get through this time. And that's a really tough thing to do. I was just thinking actually I don't know whether it's the same across all of midwife teams, but there is often, we're in South London and at George's, they have a mental health lead in the midwife team.
Yes.
So one of the midwives is kind of the lead and has extra training in that area. Do you know whether that's like standard across the UK or is it just...
That should be standard, yes. You normally have a lead in most areas. So you should have a mental health midwife. There should be like a bereavement midwife as well. Now, it doesn't always mean that these midwives are going to be around for you, but let's say that you've had a loss before, because loss and infertility, unfortunately, they often go hand in hand. Especially, recurrent loss, early miscarriages, they are something that people experience. So you can ask to speak with the bereavement midwife. If you are terrified in this pregnancy that the same thing's going to happen, the bereavement midwife has had training in how to support you properly. And it's like every profession, I've worked with some amazing midwives and I've worked with some questionable midwives. So if you find that you don't have that connection with your healthcare provider, you can ask to see someone else. There does seem to be this thing in the NHS that you get who you get, and it's tough. That's not always the case. If you don't feel you're being supported enough, you can go to a different clinic or ask to see a different midwife within that clinic, depending on the setup, because I know across the UK it works slightly differently. I know that some areas do like a continuity of care where you have the same midwife that will support you throughout pregnancy and then will come in with you in labour, which I love and it's amazing. But it's also quite difficult to navigate. So you might maybe have a team, or you could just have a midwife that you see in the community, a different midwife when you go in to give birth, and then you might see that midwife after you go home as
Yeah.
well.
Yeah.
And it's just important to raise that and ask to speak, say, is there any specialists in the team that specialise in bereavement or in mental health that I can speak with?
Yeah, because I guess it's about getting as much support as you possibly can to get through this very, very difficult time. So,
Yeah.
yeah, I always say try and find out who it is, reach out, if you feel like you want to. The other thing I often say is around accessing, like you mentioned, some counselling, some CBT, just some really practical techniques to use on a daily basis, whether it's breathing techniques, grounding techniques, to kind of,
Yes.
when you find yourself spiraling, to kind of have somebody talk you through things that you can do to help breathing in those moments can also be really helpful. I was going to say something else and I've completely I know what I was going to say. The other thing that I talk about a lot these days is about accessing doulas and looking at doula support through your pregnancy, because I feel like again, it's like nothing can make it, nothing can take it away, but what can you add in?
Yes.
So you feel, because I think feeling supported and held through that journey is the best thing that you can do. And, NHS midwives, obviously, as you know, are completely stretched and hospitals are busy. And so I just, think if doula is an option for you at the other end, I think it can be a really, really helpful support.
Yeah, it's interesting you said that, because I was at a mum and baby support morning this week, and it's actually run by a doula friend of mine here in the UAE, and she does it every week, and it's so lovely because she used to be catering, so her cooking is amazing. So she does a breakfast, and everybody comes in, and it's completely free, and we were talking about the doulas here, and the difficulty is here in the UAE is private care. So you see a doctor, you choose your doctor, you choose who you want to see, and then they're with you throughout. But the conflict you can sometimes have with an obstetric led versus a midwifery led is, in midwifery we're very normal focused, so we don't really like doctors involved unless there's a complication. Whereas doctors, they like to be say a little bit more in control, but you can sometimes feel, women sometimes feel like they don't have as much choice, and if their doctor's going on leave, then they're going to have an induction, or they're going to have a C-section. So I think this role of a doula is very supportive, and like you said, in the UK and the NHS, midwives are stretched and they can't always give that one-to-one support that we love to give. And having a good doula, and I know that there is, and it's completely, the names escape me. I've got an amazing friend in the UK called Emma, and she was a midwife, and then she's now a doula because she found that she couldn't always give the care that she wanted to as a one-to-one. And there is like a registry in the UK that regulates doulas, and I think that's quite important, because the stigma that comes from doulas sometimes can be, if they're giving medical advice, which they're not supposed to, which we've had here in the UAE, and then that causes a conflict, and you don't want that. You want a team around you that's going to be supportive. So there is a network in the UK that you can access, and I've forgotten the
I think it's Doula UK, isn't it?
Is it Doula UK?
Yeah, I think so. That's often who I recommend people to. I always just give the website, because again, it's a bit like finding an acupuncturist. You have to find one that you connect with. It's not always about their qualifications and skills, although they are important, but it's about finding somebody that you like, that you feel comfortable with. And I feel like a doula is the same, isn't it? So
and they're going to support you through that. They're going to support you through the whole process, and also through fertility as well. There's a lot more people training to become fertility doulas, with that support and that awareness. And it's it's the kind of support that I provide, it's the kind of support that you provide. But having somebody that you can speak to and is there for you throughout the whole process, really, from beginning to end.
Yeah. And I think just sort of wrapping it up, I was just thinking, that is the thing, isn't it? It's about acknowledging that this is tough.
Yes.
That's the first thing. It's not about, oh, now everything's going to be okay. It's about saying, actually, this is now a new difficult thing.
Yeah.
I've gone from one difficult thing to
another.
a different difficult thing. And it's okay to acknowledge that and acknowledge it. And then thinking about, okay, what support do I need? And again, it'll be different for everybody, won't it? Some people are like, it'll be talking with a friend. Some people, it will be counselling. Whatever it is, it's about just having some time, spending some time thinking about what it is that you need to help you through this difficult time.
Yes. Couldn't have said it better myself. And honestly, it's making sure that you are the priority, which is something that we don't do. And then when you become a mother, and you will become a mother, if, like, I say you will, there's no guarantee, but what I mean is the pregnancy, you get a baby at the end of it. It's okay to think of that. It's okay to prepare for that. The amount of women that I speak with that are like calling me and going, okay, I need antenatal classes, I need support with how to look after this baby because I'm now 37 weeks and I never thought I'd get this far, and I can't quite accept that this baby's coming. It's okay to accept that you will get a baby at the end of this. It's okay to think that's going to be the goal. It's so easy for us to think of, this is going to go wrong, this is going to end badly, and then unfortunately in some cases it does, and people do experience loss, and loss is horrendous and it's really, really difficult, but people do have live babies at the end of this. It's okay to accept that that could be you, and then approach that. You can prepare, and you can do sessions on caring for your newborn, and you can do sessions on breastfeeding, and you can do those things to be prepared, rather than when you're handed your baby or when you give birth to your baby, you look at this little human and go, oh my gosh, what am I going to do with you now? You can accept that that's going to be your reality, and it's okay.
Lovely, Hazel. Thank you so much. It's such an important topic, and I'm so glad we've had this conversation, because I know not everybody will want to listen to this immediately, but I think when people are in this situation and they find this episode, I really hope that they find something helpful to take away. So thank you for your time.
Thank you so much for having me. It's been a pleasure.
If you've enjoyed listening to this and want to find out more, then come and join my free community in Facebook. We have loads of resources. You can catch up on all our previous webinars and be the first to know about forthcoming events. To sign up, just follow the link in the show notes. And if you'd like to work one-to-one with myself or one of the team, then please see our website, hannahpern.com, where you can book in directly or organise a discovery call to find out how we can support your fertility and your reproductive health.